You're listening to ABC Radio Queensland.
How often do you have to travel for your health? It's no secret that we in the regions have to travel far and wide to access the many health services that are only accessible in the major cities. But technology is proving it can pave the way to more health equality. The Mater Hospital has partnered with a virtual cardiac rehabilitation program that provides heart attack patients with a crucial post-rehabilitation services from their own home through an app. CardiHub CEO Helen Souris spoke with the ABC's Jonathan Paulson.
The partnership for us between Mater and CardiHub is to really help improve access to cardiac rehab for anyone who's had a cardiac event, a heart attack, or some sort of cardiac procedure in the region. So through this partnership, we can actually get people into a program of recovery after they've had their heart event. And it's a really important initiative to provide resources to regional areas and parts of Queensland that may otherwise miss out.
What need was identified in this space that led to this partnership?
A lot of people that have procedures, heart-related procedures, have to fly in cities where those centres of excellence are. And when they go back home, they don't actually have access to care programs in their home communities to help them with their recovery. So there's this massive hole, I guess, in the health system of being able to provide people in regional areas access to cardiac rehab. So what we're doing is, through the virtual program, enabling people to complete a program of care in their home community and actually be supported by people closer to those communities. So setting up this regional hub in Townsville to support Northern Queensland is a really important step towards making high-quality healthcare accessible and reachable for people in those areas.
With this partnership, people will be able to access or receive rehab care in their own home. What sort of care would that look like?
So CardiHub's rehab program is a 6-week recovery journey where they've got a special purpose-built program for their risk factors and health needs delivered through an app, and each day they'll get a reminder of their medications or exercise to do or what symptoms to watch out for, and they'll have a weekly conversation with the healthcare team to actually coach them through their recovery journey, talk to them about how they're progressing, provide them with some guidance around exercise. And I guess it's that ability to stay connected to a qualified healthcare professional that actually supports you as things come up over the 6 weeks after you've had your heart attack. So it's a really important connection that we've got humans on one side and technology on the other coming together so that people are supported through the 6 weeks after their event.
How far does the app go to providing care to patients? Are there any gaps between that service and what's provided face-to-face?
I think the key thing is that the face-to-face option is great if you can access a clinic within an easy proximity, and most of the people that living in regional Queensland have to travel hundreds of kilometres to get to a clinic. And the other thing is there's wait lists are massive for face-to-face programs. So even if you wanted to go to a face-to-face program, you have to wait months, if not sometimes 6 months, to get into a rehab program. So it's just not even an option for so many Australians. In fact, 80% of people who should be in a rehab program miss out for those two reasons. So what we're trying to do with our technology is, through video calling and through the connection of phone calls with the patient, is actually give them access to quality care. So our program covers medication adherence, exercise, diet, guidance around what safe activity is, education around why your heart event might have happened in the first instance, try and support the patient as best as possible. But most importantly, it's the conversations that they're having with the healthcare professional about their information, about their symptoms, that coaches them through their recovery journey. So we're trying to bridge this massive gap that even if you wanted to do face-to-face, people just aren't getting there because there's not enough clinicians available and there's not enough space in the traditional rehab programs to accommodate them.
Is there anything that people are missing out on from going online compared to face-to-face? Or is it all covered?
No, we've covered the complete program of our cardiac rehab design is to fit in with the clinical guidelines. So what people should be doing through a traditional program of care is adequately covered through the virtual program. One thing you won't get, though, is you won't be standing on a treadmill with a physician next to you or an allied healthcare professional next to you as they watch you do a treadmill exercise, for instance. Or you won't necessarily have that in-person group discussion where you're sitting down in a group around a clinic and talking to other patients directly in person about your rehab. So those are elements that we see are different to what you might get in a face-to-face program. But the critical issue we're trying to solve is that there's not enough space in the systems across Australia to help people into a rehab program. And at the moment, because of that, people are missing out altogether.
How important is it for that post-heart attack or post-heart problem rehabilitation to be able to bring that service to your home or to someone who may really need that crucial assistance at that time? What does it mean for those patients?
Cardiac rehab is a really important part of a recovery journey. So what we know at the moment is 1 in 3 people that have had a heart event or a heart attack will have another one within 3 months. So there's a really high chance if you don't get on the right recovery journey, if you don't start your medications as prescribed, if you don't provide yourself with a good chance of preventing another heart attack, there's a very high risk that you'll have another one. And that's what we're trying to stop. And I guess that's the critical urgency of this, is anyone who's had a heart event or heart procedure should have a discussion with their healthcare professional about whether they can get into a rehab program as quickly as is safe for that individual. And that's why we're really trying to stress the importance here. We can actually help people prevent heart events. We can actually help people reduce the risk of them having a subsequent hospitalisation or needing an emergency department visit if they get into the right model of care, whatever works for them, as quickly as possible. And if you're lucky enough to have access to face-to-face, that is awesome. But if you don't have access to face-to-face, or you have to travel hundreds of kilometres to get there, you need to get into a structured program like ours to make sure you've got your best chance of preventing another event from happening.
And when will this service be made available to patients?
Well, this is available now to anyone in northern Queensland, anyone who needs access to cardiac rehabilitation. We urge them to go onto our website and go to the Find a Provider page, where you'll get direct access to the MARTA team in Townsville to be able to see if you can apply for that program and be part of the pilot. But what we really do hope to see within 12 months, as we grow the use of this product and familiarity of the product within the region, this becomes something that can go Australia-wide. So we're really wanting to demonstrate that we can help more and more people living in those regional areas through this model of care. And our vision is to really take it Australia-wide as soon as we can see some momentum with that, with this model that we're working up with MARTA Queensland.
That's CardiHub CEO Helen Souris speaking there with the ABC's Jonathan Paulson.
You're listening to ABC Radio Queensland.